Have you ever been a patient or accompanied a loved one to the emergency department? That experience can be quite daunting. No one ever prepares you about what to expect during an emergency. There are no medical conditions too straightforward or too complex that I cannot intervene on.
Me
Nevertheless,
go and go
in that
see
emergency room encounter,
this
just like
doctor
on this YouTube channel,
for
I
me
have a short
current
period of time to
problem.
connect. So consider me Dr. Google's sister. Your
Dr.
patient-specific
Google
details can
sister.
and should be discussed with your personal physician. For nothing else but to put your mind at ease and to help set your expectations when it comes to dealing with the emergency
Soon
department.
come, see you soon, sister. Me going right now, right now.
Hi everyone, welcome back to my channel. Thank you to all my subscribers and soon-to-be subscribers. If you haven't subscribed to this YouTube channel yet, what are you waiting for? Hit the subscribe button below and click that bell so you can be notified of future videos when they are released. Today is Father's Day. Happy Father's Day! And on today's video, we are going to be talking about one of the emergency room patients that got introduced on a prior video. His name is Dalion. Dalion went home and got introduced to my YouTube channel, and he watched it and he learned a little something. One thing you guys may not know, but Dalion really liked the Dr. JB jingle. Let's watch. Dr. JB in the house. Dr. JB in the house. Dr. JB in the house. Dr. JB. Dr. JB. Dr. JB in the house. 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 Dr. JB. Dr. JB. Dr. JB in the house. Dalion had some moves on him. While watching that video, one thing that came to mind was how wonderful would it be if the Dr. JB jingle took off, went viral, and we had a dance competition. Right now, Dalion's in the lead. Let's see if anybody else wants to compete. I digress. I have heard over and over again from patients and family members that, oh, it's like pulling teeth to get my husband, brother, male cousin, or other male figure to see a doctor. The males in my family just don't like going to the doctors. Well, that's not just men. That's a lot of people. They don't like the hospitals, they don't like doctors. However, it is important that you maintain your routine visits with your doctors. But when you do go to that hospital or that clinic, you hopefully won't have a frustrating experience like Dalion had on that last video. The video that I keep referring to is called, "Why Do You Keep Asking Me the Same Questions?" And in that video, Dalion was so frustrated that by the time the doctor walked into the room, Dalion didn't want to talk to the doctor. Didn't want to talk to the doctor! Truth be told, I get it all the time. And so that's why I made this video. Because oftentimes patients tell their entire story to inappropriate staff members. So Dalion went home, he watched my YouTube channel, and he's coming back. Let's see how much he learned.
Hello, bedroom.
Name.
Dalion.
Dali what?
Dalion. They call me Dalion. Like valley, you know. Mountain high, valley low.
Okay. Dalion. Date of birth?
September 9th, 1975.
And Mr. Dalion, what brings you to Triage Medicine Hospital?
Oh, veteran. Tent.
Tent. Okay. My triage nurse is ready for you now.
Dalion did great. The first person you see when you come to the hospital is registration. Now, usually registration will greet you with a smile on their face, not like what happened on this video. They're the face of the hospital. And so usually they'll be smiling, but when we're wearing masks, they have to smile with their eyes. Something like that. But Dalian, he did exactly what he was supposed to do when talking with registration. Answered the questions that are asked. He gave them their name. He gave them his name when he was asked for it, his birth date, and a very brief explanation of what brought him in. Tent. Because that's all that registration is going to write down is tent. Good job. Now he went to see the triage nurse. Let's see how that went. Hi, I'm Samantha. I am the nurse in triage, and we're just going to do a few things. Take this, put this on your finger. Take this, put this in your ear. So, Mr. Dalion, what brings you to Traore Medicine Hospital?
Tent.
Tent. Excellent. It just beeped. So your vital signs are great. So you can go to our waiting room and our ER tech will come get you and bring you to your room.
Thank you.
Oh, you're welcome, sir. Again, perfect performance. Samantha, the triage nurse, that was an exaggeration. You will not be asked to put this on your finger and take your own temperature when you're in triage. They will do it for you. Either the nurse or the ER tech will help get your vital signs. But Dalion did amazing, right? He was very brief and gave a very brief description of what brought him in. The same thing he said to the registration. Tent, that's all you really need to know. And the role of the triage nurse is to get your vital signs and determine whether or not you are okay to be put back in the waiting room to wait a room, or if you are very sick, you have a life-threatening or potentially a life-threatening condition, like your blood pressure is really low or your heart rate is beating super fast, that would require you to be rushed right back to the emergency department. All right, let's see how Dalion keeps doing. Hi, Mr. Dalion. My name is Jewelry. I am the ER tech here, and I will be bringing you to your room.
All right.
How are you doing today?
So.
You seem a little scared.
Me? I ain't never scared. Never. I'm just a little bit nervous.
All right, Mr. Dalion. It's okay to be nervous. We'll take good care of you. Here, let me show you your room. So in that clip, both Dalion and the tech did an amazing job. The tech in the ER will help escort you from the waiting room to your room. And during that walk or wheelchair ride, they may talk to you about a variety of topics. It doesn't necessarily have to pertain to what brought you into the hospital that day. In this scene, the tech stated that Dalion seemed nervous. And Dalion was able to talk about how he was feeling, and the tech was able to address it in the moment and let him know that we're going to do our best by him in the hospital. That was fantastic.
And Dalion is currently getting an A+ for his performance. So now Dalion has made it to his room and he's about to meet the ER nurse. Let's see what happens. So, what brings you into CS?
Tent.
Okay, tense. All right. Can I see your arm? Okay. Are you able to pee? All right. So I'm going to go get some stuff so I can do some stuff on you. Does that sound good?
All right.
All right. I'll see you soon. Another A+ performance for Dalion. He got into the room and he answered the questions that the ER nurse asked. In this scene, Dalion was a little bit more quieter than normal, but you can see that the ER nurse asked some questions that were a little bit different than what he had been asked before. When you come to your room, the ER nurse has a set of questions that they have to get through for their documentation's sake. They are not necessarily the exact same questions that your doctor is going to ask. But, they'll get your pain level, your allergies, a list of your medications, and some details. Like in this case, she asked, "Are you able to pee?" And he said no, which made her realize that, oh, maybe he might end up needing some kind of other intervention, like possibly a Foley catheter to empty out his bladder while he's in the emergency department. So, next is the doctor. Let's see how that goes. Hi, I'm Dr. JB. Are you Mr. Dalion?
Yeah, man.
Hi, Mr. Dalion. It's a pleasure to meet you.
Same here.
So, tell me, how may I help you today?
Me can't tent.
Okay, tell me more.
Really? Do you really want to know more?
Yes, I do. I'm your doctor. Tell me all the details.
All right. It's been 45 days. Me can't tent. What is a lion without tooth? What is a cat if you can't catch a mouse?
Yes, he did it. Oh my goodness. Yes, Dalion. That was perfect. Whether you're seeing a physician, a nurse practitioner, or a physician assistant, they are the ones who you are supposed to give all your details to. They're the ones that are actually going to write down 45 days. Plus or minus if they're going to write down the lion without a tooth or cat that can't catch a mouse. I don't know the answer to those riddles myself. But that is the person that you need to say everything to so that they can come up with a plan for you. Dalion did fantastic. I am so proud of him. I am so happy he learned so much from my YouTube channel. So, Dalion, if you're a dad, happy Father's Day to you. So, now I'm going to talk very briefly about the reason why Dalion came to the hospital, and because not only is today Father's Day, but it also is the last day of Men's Health Week. And to address what brought Dalion to the hospital in the first place, the expression pitch a tent has to do with being able to have an erection. Dalion being unable to pitch a tent meant that he had erectile dysfunction, ED. Not emergency department, but erectile dysfunction. This is a very serious medical condition, and it can cause a lot of problems in relationships as well as self-esteem for the patient. And so it's actually really important to really address the needs of the patient and the feelings around this disorder. But Dalian's not the only person that experiences this disorder each year. In America alone, tens of millions of men experience erectile dysfunction, and globally, that number is in the hundreds of millions. So it is a relatively common phenomenon. The causes are multiple. It can be due to mental health conditions like depression or stress or anxiety, or health disorders like heart disease and diabetes. The key to preventing it is getting routine visits with your doctor where they can go ahead and perform screening examinations and can catch some of these disorders early so that they don't worsen and you experience complications from them like erectile dysfunction. There are treatment options if you are one of those tens of millions of patients who are experiencing erectile dysfunction. The treatment options include injections, pills, or surgery. And I would recommend that you speak with your doctor about those options if you are indeed experiencing ED. Well, that's all I have for you today. I hope that you found this information educational, and I hope that you will apply it to your next visit at a clinic or emergency department, and then comment below and let me know how it goes. Till we meet again, stay safe.